When choosing a genomic assay for ER-positive breast cancer, there are a number of considerations that we think about. The thing that people have focused on over the past 10 or 15 years has really been identifying a group of patients with estrogen receptor positive breast cancer that could do well with endocrine therapy alone versus those that perhaps might need to be treated with chemotherapy in addition to endocrine therapy. And so a major focus of the studies has been to utilize these genomic assays to identify a group of patients that should be treated with chemotherapy versus those that could be would do well with just endocrine therapy. And so there's been a number of these assays that have been developed, and essentially the data that we have now really does suggest that we can utilize these assays to identify patients that really can be de-escalated, if you will, from the use of chemotherapy. And the assay we probably have the most data for is the Oncotype DX recurrence score. And there are both secondary analysis of prospective trials. These were from about 10 or 15 years ago, but now we have the data from the Taylor RX study, originally published a few years ago, the randomized portion published over a year ago, and now we just had data from ESMO, where we have data from the so-called high-risk group of patients, that is patients that have a high recurrence score of 26 or above. And essentially what we know from these data overall is that patients with the intermediate recurrence score with Oncotype DX really derived no benefit of chemotherapy, and especially those that were postmenopausal. There was an analysis that was done of the premenopausal group, and that seemed to be a bit different. These patients seemed to actually obtain some benefit of chemotherapy even in the intermediate risk group, and especially those that are so-called in the 16 to 25 range. And so what we can say now is that using these assays can be helpful for patients and physicians in terms of decision making. Of course, these were data from node-negative ER-positive, HER2-negative breast cancer. We expect data from the RX Ponder study to come out soon. And those data are from the RX Ponder are looking at ER-positive, HER2-negative breast cancer that's node-positive.